Hello, everyone. Welcome to our weekly media briefing and public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today are Dr. Keisha Davis, who is the county's health officer, Dr. James Bridgers, Director of the Department of Health and Human Services, Dr. Nina Ashford, Chief of Public Health Services, and our special guest this afternoon is also a doctor, Dr. Georges Benjamin, who is Chief Executive Officer at the American Public Health Association. Thank you, everyone, for joining us. I see Mr. Sean O'Donnell, also Assistant Chief of Public Health Services, is here. Mr. County Executive, take it away.
Thank you. And thank you, everybody, for joining us today. As we enter the last month of summer vacation for many students, I want to urge everyone to enjoy August. This is the end of your vacation, and maybe even spend a little time brushing up on your skills that you learned last year. There's still plenty to do in August around the county. Last evening was National Night Out, and although I couldn't make every one of the 30 events in the community, the ones I visited were pretty well attended, and a chance for police and first responders and multiple county agencies to meet with our residents and share information. One of the important functions that Montgomery County government provides to the community is public health services, part of the Department of Health and Human Services. The role of public health was introduced to many residents during the COVID pandemic. For most people, without pandemics and without crises, we don't think much about it. COVID kind of changed that. Because much of what the public health does is prevent disease and to keep our food supply safe, they were often working under the radar. That certainly changed with the pandemic, but what we've seen over the last 20 months since the Trump administration took over our nation's government is the systematic dismantling of U.S. public health and the medical research system. There were mass layoffs at NIH, a research institution, a leader in learning about many diseases and admired around the world. Last week, we saw Dr. Anthony Fauci, the former director of NIH's Institute for Allergy and Infectious Diseases and the face of the administration during the early days and months of the pandemic, grilled by a Senate committee led by Republican Senator Rand Paul that was focused on making him the scapegoat for missteps the U.S. made, even as he worked closely with the first Trump administration. He was the voice of reason in instances where the president was reckoning Americans use untested and dangerous treatments for COVID, such as drinking bleach. Brilliant idea. Did the United States do everything right in responding to the global pandemic? Probably not, but it's kind of hard to get everything right when you're hit with something for the first time and people's lives are at stake. We did everything we could to keep people alive here. And one of the things that I was focused on as county executive is I remember in the early days of the pandemic, they were showing pictures on the news of people bringing body bags out of apartment buildings in New York. And I saw that video and I was like, this is not happening here. We did the things we needed to do to keep this community safe. It made a lot of sense. It wasn't the most fun, but it was things that kept people alive. And that is what our job is to do. No country in the world had everything figured out. There's no way to have this figured out before it happens. But we had the best scientific minds working around the clock to respond. If you watch any of the Sunday news shows, you probably saw the Secretary of Health and Human Services, RFK Jr., go off the rails about the COVID pandemic and continue to cast doubt on the efficacy of vaccines, even though he's not a physician or a scientist. Basically, he doesn't know what he's talking about, but he is the Secretary of Health. Kind of alarming that you'd have somebody that ignorant in charge of something that important. This type of rhetoric raises vaccine skepticism, and that has contributed to a nationwide decrease in children getting immunizations that help protect them from diseases such as flu and measles. The U.S. now has the distinction of having surpassed the number of measles cases in all of 2025. There have been multiple large outbreaks and 2,371 confirmed cases, the most cases reported in a single year since the disease was declared eliminated in the U.S. in 2000. Nice job, Robert Kennedy. In a word, what the president and his so-called Secretary of Health and Human Services have done is to our public health system is really tragic. My guest this week to talk about the state of public health and offer his thoughts on where we go from here is Dr. Georges Benjamin, the Chief Executive Officer for the American Public Health Association, which makes him one of the most influential physicians in the United States. Prior to joining the APHA in 2002, he served as Maryland Secretary of Health. And I learned recently that in the early 1990s, he served on Montgomery County's HIV/AIDS task force. So, welcome back to Montgomery County again, Dr. Benjamin.
Listen, Mark, thank you very much for having me. I'm enjoying being here.
Excellent. Do you have some opening remarks, Dr. Benjamin?
Yeah, let me say that we are in challenging times, and we have been beneficiary of really having a strong public health system in our county, in Montgomery County. We've always had very good health officers. We've had solid leadership, and I think that is taking us through really tough times. We did pretty well during COVID. I actually had a chance to volunteer to actually give shots at least one day during the COVID outbreak. And it was very, very important to do that for me to get on the ground and see what was actually happening in the county. So I can speak firsthand for our system, not only as a county resident, but also as a person who had a chance to participate. Um, I think it's important for our county residents to really understand how important it is to get expert advice and to follow good science. Tragically, we're not getting that out of our federal government right now. And so it is beholden on us at the local level to step up to the plate. And so we've got good public health officials, a good system in Maryland, and I think we should follow their advice. And I encourage people to make sure, particularly now, as they're getting ready to plan to go back to school, for parents to get all their kids vaccinated, make sure they're talking with their doctors to get all the required shots, both to get into school, but also to make sure that they're protected from these infectious diseases. I think in Maryland right now, we have had a recent outbreak of 4 or 5 cases of measles in the county. The good news is, I guess, that those cases people were exposed outside the county. But once you come home, you have the risk of exposing others. And I also understand that those people were unvaccinated. So being unvaccinated puts you at an extraordinary risk of vaccine preventable diseases. And the key word is vaccine preventable diseases.
Thank you very much for those opening remarks. Members of the media, do you have any questions right now for Dr. Benjamin? Please raise your hands. Oh, I see you. Hi. Good afternoon.
Good afternoon. This is maybe a question for Dr. Benjamin or maybe a question for Dr. Davis. Not sure. But has Montgomery County actually seen any recent drop in measles vaccination or any other vaccination rates for children or otherwise?
Thus far, we haven't. Hi, good to see everybody. Thus far, we haven't. We are actively monitoring. So we work really closely with Montgomery County Public Schools on vaccination rates and have started way back in the spring on vaccinations to make sure that kids are up to date. The last numbers that I heard is that we were actually ahead of where we were last year in terms of getting kids vaccinated. At the end, we'll talk a little bit more about kind of vaccination clinics and where folks can get those done. But I am cautiously optimistic that our numbers of measles vaccinations and all school age vaccines are good, are where they're supposed to be. And to Dr. Benjamin's point, when we see cases in Maryland, and we do every year, we will see a few sporadic cases of measles that usually pop up outside of the county. They don't have anywhere to spread because our vaccination rates are so high. And that's why we are not seeing the outbreaks that we're seeing in other states, because we've maintained such a high vaccination rate.
If I could add to that, it's a tragedy. This is a disease you don't want to get. You get really, really sick when you get measles. But it's also very expensive. A single case can cost anywhere from, $23,000 to $50,000 just to do all the case finding involved in this. So this is not just a matter of health, but it is also a matter of economics. It is very expensive to manage one of these outbreaks. And so that's money that could be used for education. That's dollars that can be used for our roads. That's dollars that can, be used for other things that the county council and the county executive and the citizens of our county, believe are most important. So it's a cost avoidance tool too.
Thank you.
Excellent, thank you. Members of the media, any additional questions for Dr. Benjamin? Oh, I see Christina Caicedo from Montgomery Community Media has her hand up. Go ahead, Christina. Good
Hi.
afternoon.
Hi, good afternoon. I wanted to ask today, the FDA, it's about to approve or not to approve this new flu vaccine with the technology that was developed during COVID. I was wondering, what were your thoughts about it? And do you think it's something that the Montgomery County can utilize, preventing, now that school is about to start?
Yeah, I'm excited about it. Let me tell you, remind that the flu vaccine requires us to first have chickens, and the chickens then have to produce eggs. And then we have to go through a process where we inject those eggs with the virus. It goes through a production process. And there have been years in which the chickens haven't been able to produce, the virus hasn't grown real well, and it takes months to do that. And then, of course, you have people who are allergic to the vaccine because of the way it's been grown in eggs. This will minimize all those processes. It will allow us to very, very quickly change the composition of the vaccine should the virus mutate. And, we've had years where the flu vaccine that's been produced through the old process has not been a good match for the actual flu that's circulating in the community. And we've had to wait till the next year in order to change vaccines. So this will allow us to rapidly change the vaccine if we need to. It uses mRNA technology. mRNA technology is a very useful tool. We learned about that during COVID. All the stories you hear about the risks from mRNA vaccine are just not true. And so I'm very excited about it because I think this is the future for not just infectious diseases, but mRNA vaccines for cancer, mRNA vaccines for a whole range of other chronic diseases that people have. It's the future.
All right, thank you, Dr. Benjamin. Members of the media, any additional questions regarding this topic? No more questions? Okay, Dr. Benjamin, you can remain here on this media briefing, or you may depart if you need to. Mr. County Executive.
Go silent as long as
Thank
I
you,
can.
Dr. Benjamin, for being here. And your comments on the state of public health are important. We've got to do better than what we're doing right now. This week, the Maryland General Assembly met in special session to vote on redrawing the state's congressional districts. Both the House delegates and the Senate passed the measure, which will now go before Maryland voters as a ballot question in November. The president started this when he asked Texas to do midterm redistricting. Even if we could only get one vote for the Democrats, why wouldn't we? Thank you, Governor Moore, for his efforts on this issue. And it really bugs me, the partisan play on this by the Republicans, because the president and your party has actively campaigned on this idea that they should change as many boundaries as possible to get Democrats out of Congress. And when a Democratic state does it, you act like this is a crime against humanity. None of us wanted to walk down this road. The Republican Party is the one that went down this road. And there's no reason why the Democrats should sit back and just say, oh, well, we're not going to do anything, while the Republicans attempt to gerrymander their way to stay into power. That's not what a democracy is. And it's a shame that they've driven us to have to do the same kind of nonsense that they're doing. Since signing this expedited bill 2326, I'm talking about gun legislation now. Since signing the bill 2326 last week, we learned that the U.S. Justice Department filed a lawsuit arguing that buffer zones limits near parks, schools, and places of worship violate the Second Amendment and the recent Supreme Court precedent. That is really worrisome. I cannot comment on pending legislation, but I'll reaffirm my support for any and all measures that we can take to reduce gun violence and protect our communities. This is important for us. And, we have more shootings. We've got an issue with ghost guns, which, are illegally manufactured. They should not even be allowed to be manufactured. And we need to do more on the gun front rather than less on the gun front. So we'll see what happens with this latest lawsuit. On good news, after sediment testing last week, Dr. Keisha Davis, our county health officer, lifted all remaining health advisories for the Potomac River shoreline and sediment. This includes removal of the contact advisory specific to the shoreline and river sediment between Loch 11 and the shoreline surrounding Minnie's Island. In addition to ongoing water monitoring, sediment testing in these areas has shown the bacterial concentrations have returned to acceptable levels. Residents may resume recreational use of this area, but I want to add recreational use is not swimming. She will give additional information later in this briefing. Sadly, last week, another young person, 25 years old, drowned in the Potomac River. That brought this year's total to 3 in the last 3 months. I want to express my condolences to the family and friends of the victim, a young man from Virginia. Montgomery County Fire and Rescue Services and the Montgomery County Department of Police are working with U.S. Park Police on a public education campaign about the dangers of swimming in the river. Last week, they filmed several public service announcements that are going to be shared widely on social media. I'm going to say this again. It is illegal to swim in the Potomac River, and it is dangerous to swim in the Potomac River. Avoid swimming in the river due to strong currents and sudden drops in the riverbed. We've got other places you can swim where you don't necessarily risk dying because of an undertow. Please swim safely and stay out of the river. Another good news, I was pleased last week to join Maryland Comptroller Brooke Learman and other elected officials as the Comptroller opened a new office in Rockville. The Comptroller's office serves Maryland residents and businesses by administering the state's tax system, providing taxpayer assistance, collecting revenue, and promoting fiscal accountability. The new Rockville branch office, located in King Farm, will provide county residents and businesses with convenient access to in-person services, reducing the need to travel to Annapolis for assistance. This week is also National Farm Week that runs through Saturday, August 8th, and there are more than 30 farm markets in Montgomery County, and it's the height of the summer produce season. If you don't have the space in your own garden or don't have a green thumb, check that out. There is no way you will be disappointed. Find information on the farm markets available in our Office of Agricultural website, and that is https://www.montgomerycountymd.gov/office-agriculture. Before we open it up to questions, I'd like to give my staff an opportunity to provide any updates they want to share, and we'll start with our health team.
Good afternoon, Mr. County Executive. Montgomery County is public health strong. So having said that, I will turn it over to our amazing public health team, Dr. Davis and Dr. Ashford and Sean O'Donnell.
Thank you, Dr. Bridgers. Such a pleasure to have Dr. Benjamin, who's been a champion for public health for his career, and we are really excited that he calls Maryland home. So he's a great resource for us. As we talk about measles and vaccination rates, again, I want to reiterate the importance of vaccines. Even on that interview, RFK Jr., the Secretary of Health, did say that the MMR vaccine is effective and important in preventing measles. And in this county and in this state, we have high vaccination rates, and that is directly what impacts and causes us to have low rates of measles, why you have not seen the spread of measles in other places here, because we have such high vaccination rates. And as we are getting back to school, it is a good time to make sure that our kids are up to date on their vaccines. There are a number of vaccination clinics that are happening across the county. So we encourage you to get your children vaccinated, make sure that they are up to date with their vaccines. Either see their PCP to get that done. For kids who are uninsured or have Medicaid, they can get those done at the health department. We will include the link for those vaccination sites. We are also partnering with Montgomery County Public Schools. They are having a number of back to school fairs on August 21st, and we will be at a couple of those. I know that we will definitely be at Paint Branch High School providing immunizations. We will also be at potentially be at another site. So again, encourage folks to get those vaccines. The county does make those available. The county also has available vaccines for adults who are uninsured or have Medicaid. This is the first time that we have been able to do that robustly. And so we are excited to extend that opportunity, not just to children, but to adults as well. I do want to comment also, you may have been hearing in the news around West Nile virus. There was a case of that in Maryland. We just recently learned of a case of dengue in Virginia. These are all mosquito-borne illnesses. And this is the time of year when mosquitoes are quite active and out and about. And we want to remind folks to take precautions around mosquitoes. So wearing bug repellent if you're going to be outside, or putting candles out, or things that will repel the mosquitoes, wearing long sleeves and long pants, light fabrics to, again, try to prevent those mosquito bites, keeping doors and windows closed or screens in place to prevent them from coming inside, and also reminding folks to get rid of standing water. It takes about a week for mosquito eggs and larvae to turn into mosquitoes. So especially with the rain that we got this morning, make sure that that's not filling up in buckets and drain spouts, and that that is getting tossed so that we don't breed mosquitoes. So get rid of that standing water so the mosquitoes can't breed. And then when you're out and about, we want you to get out and enjoy the last few weeks of summer, but do it safely. Wear that bug repellent, or keep those limbs covered. And with that, I will turn it to Dr. Ashford and Mr. O'Donnell if they have any additional comments.
No additional comments from me. Thank you, Dr. Davis.
And I have no additional comments either. Thank you.
Okay, thank you, doctors. Members of the media, questions for the county executive and the health team? Raise your hands. Okay, there you are again. Hello, Ms. Hackleby, Bethesda today. Go ahead.
Hi, this is a question for the county executive. I don't know if you saw this news out of New York, but the Trump administration was successful in their lawsuit against the state of New York for a mask ban related to ICE officers. I was just wondering if you're concerned that maybe that victory could lead to another legal challenge against Montgomery County from the Trump administration, if the county has any sort of plans to take another look at its mask ban, anything like that.
I don't have any plans to take another look at it. I mean, we'll see what happens in court. I don't know the details of their ban. I don't know if they did things that we didn't do. We'll see what happens. It's still the right thing to do. And it's absurd that you've got masked people enforcing the law, and you don't know who these people are. You can't identify them when they do things that are wrong. You can't identify them. It's just ridiculous that they go through that level of hiding who the people are who are doing stuff, which we've seen all too often turn violent and turn ugly. So we'll wait and see how the court sorts all this out.
Thank you.
Thank you. Christina Caicedo.
Hi, I was wondering if Mr. Elrich, the Damascus Library is been under renovation for the last year and a half, and it's scheduled to reopen this fall. I would like to know if it's going to open this fall, if plans are going through, and any update you have on that matter.
I don't have an update. I mean, I wish I had gotten this in advance. I could have tried to get an answer out of staff. I know nothing. Nobody's come to me and suggested that there's some delay in this project. So I can find out, and I can have our comms team get back to you afterwards to see if there are any delays. But as far as I know, haven't been anything that would prevent its opening.
Thank you. Katie Barlow, is that you? TOP?
It's me. Hi. I have a question for the county executive. Thanks for doing this, as always. I'm given the recent lawsuits, I believe there are now 3 against the gun control legislation. Not asking you to weigh in on the substance of the lawsuits, because I know you can't comment there, but given the financial constraints that the county is experiencing with MCPS, with the budget, with property, tax credits getting zeroed out, which I know you're against, all of these lawsuits were reasonably anticipated before you signed it into law. And I just want to get your assessment on how much money and the value of spending that money defending now against 3 just in the first week since you've signed it.
Nobody likes spending money unnecessarily, but we're not going to know whether it's unnecessary until we play this out in court. I mean, our job is to try to protect people, and gun legislation is important in accomplishing that. And I would rather fight and then surrender when I have to surrender if there's a court decision than to prematurely surrender and put people more at risk than they need to be put at risk. Um, the, you know, it's really hard for me to reconcile the Constitution with the blanket, anybody can have a gun anywhere, anytime kind of mentality, because, what the Constitution talks about is a well-regulated militia. It doesn't say a bunch of crazy people in the neighborhood can walk out with guns. And, back in the old days, they had an armory. And if you had to get guns, everybody went to the armory and got their guns out of the armory. We've gone way far in the other direction, away from rationality. And, we've got an irrational president, we've got an irrational Congress. We're just not going to surrender. If we get to a legal point and we lose in court, we lose in court. But I'm not going to surrender protections for people just because we're dealing with folks who are irrational.
Just one quick follow-up there. We are in the land of Rahimi and Bruin under this Supreme Court. Are you concerned that this would actually kind of center Montgomery County and put it in a position to really upend even more limitations on gun rights, and that it would kind of put Montgomery County front and center to be the next poster child of, moving the ball even further in their Second Amendment jurisprudence, given the trajectory that this court has already displayed? I mean, do you want Montgomery County to be, the face of that change?
I think we're about in the place we need to be. I'm not a believer that, guns should be totally outlawed. I'd be really happy if you just had things like, no minors, no ghost guns, which are a real problem, and no guns for people who've been convicted of crimes, from people who've been accused of sexual offense or spousal battery and things like that. And I talk to a lot of people who have guns, and most people I know take a more rational approach to this in the administration. If you ask people, should a person who has a history of violence be able to get a gun? Most people I know would say no. If you've demonstrated that you'll use violence against another person, people aren't anxious to say, yeah, let's put a gun in that person's hand. It's a matter of his constitutional rights. I think most folks would err in the opposite direction. So I'm not a proponent of things that would be as extreme as banning guns. I think we're kind of in the right place on this. I think, most people have said a compromise, sensible compromise is something reasonable. That most people can live with. And like I said, I think most gun owners actually don't agree with the NRA position that anything that restricts gun use is a bad thing.
All right, we're good. Thank you. I see you have your hand up again. Go ahead, Shirley.
Yeah, last one. On this same topic, I'm just curious if you feel like, looking back, obviously hindsight is 2020, but that it was maybe an error for the county to try and go further than the state on this, given that it has now been challenged in federal court as well as obviously in state court, which is what led to, the amended law that you just signed.
I don't know. You never know. You never know whether the states push the limits to the limit or whether we push the limits. And, I understand the sentiment of trying to do something a little bit more. I signed the bill because if you could do more, I would do more. If we have to, but the judges order us back to the state's restrictions, it's still better than nothing. And it gets us, most of what we wanted. So I'm content to deal with this. And it could have been better, but, not doing anything would have been worse.
Thank you.
Thank you. Okay, members of the media, any additional questions for the county executive today or the health team? No more questions? Thank you for joining us. Have a great afternoon. Stay safe, and we'll see you next time. Bye-bye.
Take care, everybody.